Today we're plunging into a topic that affects nearly half of all adults in the U.S.
Yeah, and often without them even knowing it.
Exactly. High blood pressure, the infamous silent killer.
hmm
Our mission today is really to go beyond the usual suspects, the common causes. We want to uncover some, frankly, surprising factors.
Overlooked ones, definitely. Things that could be impacting your health right now.
And then we'll get into some actual strategies.
hmm
Prevention, management, helping you get informed fast.
It's so important because, blood pressure is, as Dr. Akshay Syal puts it, one of the most important vital signs we have.
There you go, crucial.
Absolutely. It's like this dynamic window into your overall health, constantly signaling how your body's doing.
And the stakes, they're incredibly high if it's not managed.
Oh, yeah. Untreated hypertension significantly raises your risk. We're talking heart attack, stroke.
Heart failure, kidney disease,
Hmm.
even things like dementia, cognitive issues.
Stuff.
So let's dig into some of these lesser-known culprits, things that might be silently messing with your health.
Okay, let's do it. Dr. Seil points out some really unexpected triggers, things people just don't connect to blood pressure usually.
All right, first one, sleep apnea. This happens while you're asleep, obviously.
Right. Your airway gets blocked repeatedly.
You often hear about loud snoring, maybe waking up with headaches.
Classic signs.
But the intriguing part is the oxygen link. These blockages cause oxygen levels to drop during the night. How exactly does that force the heart to work harder?
Well, think about it. Your body isn't getting enough oxygen. It panics, basically.
Like a stress response.
Precisely. It kicks into a chronic fight-or-flight mode all night long. This constricts blood vessels, keeps your heart rate up.
And over time, that sustained pressure becomes, well, high blood pressure.
Exactly. It's not just about feeling tired. It's a real physiological strain night after night.
Okay, this next one, honestly, it surprised me. Loneliness.
Yeah, it seems counterintuitive, doesn't it?
Yeah.
Social isolation impacting heart health.
Totally. Can you walk us through that, like the biological pathway? How does feeling lonely actually raise blood pressure?
It's fascinating, really. Loneliness isn't just a feeling. It triggers physical responses. It contributes to chronic stress,
Okay, stress makes sense.
but also increased inflammation throughout the body. And it can overactivate your sympathetic nervous system.
The fight or flight system again.
That's the one. All these things together tighten blood vessels, mess with how your body regulates pressure normally, and keep it elevated.
Wow, okay, another surprise factor, this one from the medicine cabinet, pain meds,
Specifically, frequent use of over-the-counter NSAIDs.
like ibuprofen, naproxen,
hmm
the stuff people pop all the time for headaches or muscle pain.
Right. And many see them as totally harmless.
So what's the hidden danger for blood pressure?
Well, the thing is, NSAIDs can make your body hold on to more sodium and water.
Fluid retention.
Exactly. That increases your blood volume, puts extra strain on your kidneys, extra strain on your heart, and that pushes blood pressure up. It's subtle, maybe, but over time, it adds up.
Good to know. And finally, number 4, a sneaky one often overshadowed by salt.
Excess sugar.
We hear, watch your salt constantly for blood pressure. But sugar.
Yeah, it plays a critical role, often underestimated. Diets high in added sugars, especially fructose, they're strongly linked to increased blood pressure, mostly because they promote insulin resistance and inflammation.
Which messes with your metabolic health.
And that directly drives up cardiovascular risk. It's not just about calories, it's how your body processes it.
So with all these factors, what about the actual numbers? What should people be looking for?
Dr. Seale gives some good benchmarks. Ideally, you want to be around 115 over 75 millimeter Hg.
575.
Got it. But if your numbers are consistently creeping up, say, above 120 over 80, that's when you really need to talk to your doctor. That's the threshold for a serious conversation about management.
And management isn't just pills, right?
Not at all. It's really about a combination of proven strategies, empowering yourself with knowledge and action.
Absolutely.
Yeah.
So let's talk practical steps. What can people do?
Well, physical activity is key.
Right. Aiming for about 30 minutes of moderate exercise most days. Think, getting your heart rate up, but you can still talk.
And focusing on diet, really cutting back on sodium and that hidden sugar.
Which means reading labels, choosing whole foods.
Definitely. And then there's stress reduction. Things like meditation, deep breathing, yoga.
Yeah.
They can actually shift your body's response.
Don't forget sleep. Addressing sleep issues, especially potential apnea.
Crucial for those oxygen levels we talked about.
And if lifestyle changes aren't quite enough, medication might be needed. Plus, Monitoring at home. Those home cuffs are pretty easy to use now.
They really are. It puts you in control of tracking your numbers.
Now, something alarming is that this isn't just an issue for older people anymore.
No, it's shifting younger. It's quite worrying, actually.
There was recent research from the American Heart Association's Hypertension Scientific Sessions this year.
Yeah, the 2024 data.
Nearly 23% of adults aged 18 to 39 already had high blood pressure. 23%.
That's almost 1 in 4 young adults.
And for kids aged 8 to 19, 8.7% had elevated blood pressure, and 5.4% already had hypertension.
Kids. That's starting so young. What are the long-term implications of that? It's huge.
And it gets worse when you connect it to social factors.
See social determinants of health. Absolutely critical link. Studies show unmet needs, food insecurity, no insurance, low income.
How big an impact does that have?
Huge. Young adults facing those issues were 80% more likely to have untreated hypertension.
80%.
And 70% more likely to have it uncontrolled, even if diagnosed. One researcher, Thomas Alexander, called it a public health wake-up call.
You think? And the kids' data, another study, 2,600 youths, 8 to 19.
What did that show?
Boys more likely affected than girls. Severe obesity was a major factor. It got worse with age.
Makes sense.
Interestingly, Hispanic youth had the lowest rates. But Dr. Benita Faulkner, who leads the pediatric guidelines, she warns that about 5% of adolescents are hitting adulthood with hypertension. That sets them up for early heart disease.
5% doesn't sound like much, but across the population, that's a lot of young people starting behind the 8 ball health-wise.
It really highlights the need for a broader view, doesn't it? More holistic perspective.
Exactly. And that's what places like Yale Medicine's Preventive Cardiovascular Health Program are doing.
Tell us about that.
Well, Dr. Erica Spatz and her team, they emphasize that so many patients just don't know they have high blood pressure until a routine check.
Back to the silent part.
Right. So education, early detection, making care accessible. It's all key.
And they look beyond just the physical, right?
Yeah.
Dr. Spatz and psychologist Dr. Allison Gaffey, they talk about emotional factors.
Yes. Anxiety, depression, discrimination, loneliness again. They all play a powerful role. Chronic stress is a big driver.
How does that chronic stress work physiologically?
It can keep your cortisol levels elevated. Cortisol is the main stress hormone.
Okay.
And that messes with the whole system that regulates blood pressure. It keeps your body kind of on high alert, makes it harder for blood vessels to relax when they should.
So Yale is trying to overcome barriers like people not having transport or time.
Yeah, they're doing some innovative stuff with remote monitoring.
How does that work?
Patients get home blood pressure cuffs, the kind that automatically send the readings to the health team.
Oh, neat.
The team reviews the data weekly, adjusts treatment plans, checks in. It makes it much easier for people to stay on top of it without constant clinic visits.
That sounds really promising for making it more accessible.
It is, and it ties into this idea of finding different approaches, maybe complementary ones.
Speaking of different approaches, let's shift gears slightly. There's a natural, lifestyle-based method from India gaining attention.
Ah, yes. Dr. Pramod Tripathi from Mumbai, he talks about the MAP formula.
MAP. Okay, break that down for us. What does each letter stand for?
Sure. So M is for magnesium.
Magnesium. Why that?
It's a vital mineral, helps relax blood vessels, supports muscle function. You find it in leafy greens, pumpkin seeds, or supplements like magnesium glycinate can help.
Okay, M is magnesium. What's A?
A is for abdominal breathing, deep diaphragmatic breathing.
Like meditation breathing.
Exactly. It's a powerful way to counter stress. It activates your parasympathetic nervous system, the rest and digest mode, which directly helps lower blood pressure.
Makes sense. M-A-P.
P stands for prolonged fasting.
Fasting. Interesting. How does that fit in?
Dr. Tripathi suggests periodic fasting, maybe like a 48-hour fast sometimes, can help reset insulin sensitivity and reduce blood pressure.
48 hours. Okay.
But, and this is really crucial, you absolutely must consult your doctor before starting any fasting regimen.
Right. Or any major health change, really.
Definitely. Especially fasting. It's not right for everyone and needs to be done safely under guidance.
Good caveat. But that MAP formula, it really shows how these foundational things, minerals, breathing, even eating patterns, can tie back to those hidden triggers we talked about.
It connects the dots nicely.
So let's bring it all together. What are the immediate practical steps you listening can take starting today?
Okay, first off, get screened. Annual blood pressure check. Non-negotiable, even if you feel fine.
It's that early warning system. Second, embrace heart-healthy eating. Think DHAH diet, Mediterranean diet. proven winners.
Lots of fruits, veggies, whole grains, lean protein, less processed stuff. Third, stay active. Get that movement in most days of the week.
Fourth, watch the alcohol. The guidelines are generally fewer than 14 drinks a week for men, fewer than 9 for women.
Moderation is key. Fifth, maintain a healthy weight. Extra pounds are a major driver of hypertension.
And finally, maybe most importantly, partner with your doctor.
Right.
Follow the plan, ask questions, be consistent.
Communication is vital. Ultimately, preventing, managing high blood pressure. It really starts with awareness and realizing it goes beyond just physical stuff.
Right, it includes emotional factors, social factors, your whole environment.
Our well-being is all interconnected.
Yeah, it's clear high blood pressure isn't just about the numbers on a cuff.
Not at all. It's about your entire life. And maybe that leaves us with a final thought for you to consider. What hidden factors in your own daily life, subtle stresses, sleep habits you ignore, maybe even things you eat or drink without thinking what might be subtly influencing your health, beyond the obvious stuff?
Yeah, think about the power you actually have